I think it's very important to be really quite focused at the beginning in terms of getting those early adopters that can help you validate your proposition, but also establish that evidence base that shows the impacts that you can make. Hi, I'm Paul Lando, and I'm the founder and CEO of Careology.
And what is it that you do at Careology?
So Careology is a platform that we built in the digital cancer care space. As I say, it's a tech platform which is all geared towards better supporting somebody who's received a cancer diagnosis, and how we then connect that person to both friends and family acting as caregivers, but also to their healthcare team, with the whole idea being is how do we better equip someone to be a better patient, but make sure they've got that external support built in around them as well to help them get the best possible outcome.
And I assume this external support and the tech that goes behind it has been more important than ever over the last sort of year or so, where it is at times more difficult to physically get to the patients.
Absolutely. So, the Careology concept came about, predated COVID, really through identifying lots of issues around how, when a patient is at home, especially in between cycles of treatment, how you can, I guess, remove a lot of the onus that's put on them to make often quite clinical judgment calls as to when they let the healthcare team know about things that they may be experiencing or things that they're worried about. But there's no doubt that the last year and COVID has just exacerbated and amplified all of those problems. So, these days, people are trying to be kept out of a hospital setting as much as possible to reduce the risk of infection and the risk of someone who's already in that vulnerable category picking up COVID. So there's no doubt that the tools that we've established have an even more important role to play today than they did previously.
And has this grown the company quicker than it would otherwise, having this sort of tough time where it really is needed more than ever?
Yeah, look, I think COVID has definitely been a double-edged sword for a lot of players in the health tech space. There's no doubt that health tech is an area which can be quite conservative. We look in every other sector probably that we live in. We've all embraced technology for everything from our shopping and how we get around, how we bank. Healthcare is probably one of the areas which has lagged a little bit. But there's no doubt that over the last 12 months, even the most conservative of clinicians has recognized they've had to embrace technology. And I strongly feel that now the genie's out the lamp. And there's now much broader recognition for the opportunity that digital should be playing for the benefit of everybody at the table.
Absolutely. So let's take it back to the beginning then. So how did you really spot the need for this service and product? And how did you bring that to light?
So I had worked in the health tech space for about 15 years now. Prior to starting Careology, I ran a venture called Fitbug that was very early into the wearable technology space. So I had spent a long time building a platform previously that was much more at the health and wellness end of the spectrum, but looking at how you could use devices and sensors and really engage in technology to help somebody achieve the health outcome that was important to them. And interestingly, as the wearables market started to really take off and become more better understood, I actually had this drum that I've been banging for a while about how do we start to adopt a lot of these learnings and principles into much more of the med tech space. What I didn't know and this was kind of over around the 2015 type period, what I didn't know as I was banging that drum was that a few months later, my wife would be diagnosed with cancer. She was actually pregnant when she was diagnosed. She was 34 weeks pregnant. She went on to have a C-section, so she could start her treatment as soon as possible. And that's exactly what happened. She went from diagnosis to C-section to starting chemotherapy within a window of about 2 weeks. Now, from my perspective, as I watched Lucy go through her treatment really over the course of 2016, I just saw with my own two eyes what a gap there was for how technology could be better supporting somebody going through such a daunting diagnosis, as any cancer diagnosis obviously is. And there were just so many opportunities, as I mentioned earlier, around how scary, how isolating a cancer diagnosis can be, but that point about how much onus is put on someone when they're at home to manage a raft of things that you need to get really very good at managing really very quickly. And that is, managing your symptoms and your side effects, correctly taking a raft of really quite complicated medications, and you've got different doses of different drugs on different days. That in itself can be very daunting for somebody. How you help someone maintain a treatment journal so they can accurately recall and recount to the clinical team how they've been after each cycle of treatment. So there were lots of things that at the moment were quite manual processes. And from the research I did, there was this void in the cancer space for really good end-to-end solutions that were really patient-centric. And again, another key insight, James, was how do we create something which is consumerized? Just because you have a cancer diagnosis, and the same as any diagnosis, if I was diagnosed with something tomorrow that I wish I hadn't had, I'd still be the same person that I am today. I wouldn't want to be treated any differently. And really front of mind was how could we create something that did just that, felt familiar, was engaging, interesting, didn't suddenly need to become dry and clinical and stigmatizing just because we're helping somebody with a cancer diagnosis.
And it sounds like it's a real product that makes complete sense for the patient in this case, so not having to do things so manually, as you mentioned, a bit of peace of mind for family and loved ones around it. How does it work commercially then, when I suppose selling this into whether it be NHS or private or however you do that? How do you convince them that there's this real need?
Yeah. So when I first was kind of ideating the concept, I spent a lot of time talking to as many nurses, consultants, patients, anyone who I thought could add to the perspective and I guess sense check the concept that was bubbling away at the time. And very quickly, I got a real sense from clinicians that I spoke to that it could often be quite frustrating that you have patients who become seriously unwell due to things that could have been managed very easily if only they had known about it earlier. So a really good example is someone who has a suppressed immune system because of chemotherapy that they're on. They pick up an infection and decide to take 2 paracetamol when they get a fever and hope it's going to go away. Now, clearly it doesn't, and all you do is mask a problem that a few hours later can turn into sepsis, and suddenly you're dealing with a far more complicated problem. And so very early on, it became clear that the clinical fraternity bought into the concept and really would welcome a way that would allow them to work far more proactively and have more insight to allow them to do their job better. And really our main go-to-market through Careology is kind of a B2B SaaS model, where our main route to market is to be to license the Careology platform to the healthcare providers, whether that's the NHS or the private sector, and also potentially private medical insurance companies if we're working with a private provider, to help them achieve a few different things. And those benefit levers I've kind of alluded to already. So some of them are around patient experience. How do we help that person feel more in control and safe as they're going through their treatment? So that's important. But also really importantly, in terms of productivity gains, capacity gains, how do we help a provider work more efficiently? There's lots of things that Careology is enabling here. And we talked a little bit about COVID and exacerbating some of these problems. Unfortunately, we're all reading in the press at the moment and over the last few months about the issues around cancer services and the number of people who remain undiagnosed or are starting treatment late. So looking forward, there's going to be huge amounts of issues around capacity, safety. So, using tools like Careology, how can we help prioritize, make consultations more efficient because they have data insights that can help steer conversations? How could we reduce wastage around drug administration and people not adhering to their medications properly or causing complications that then need to be tackled because they haven't been adhering to their meds properly? So
Mm.
there's lots of different reasons here for why patients will engage, because it's helping them and helping them feel more secure. But from that provider perspective, it's really arming them with the toolkit that allows them to work more effectively and efficiently as well.
Yeah, so when working with the different providers, so I think the bulk of our audience will be familiar with what it's like to set up these sort of commercial partnerships with private organizations. What is different when working with a much bigger organization like the NHS that is public and notoriously slow and sometimes difficult to get through to? What have the real learnings been there?
Yeah, well, I think we talked earlier around the healthcare space being quite a conservative industry. It's very evidence-based and evidence-led. Um, so there's no doubt for any early stage venture looking to penetrate the NHS or the private sector, I think it's very important to be really quite focused at the beginning, um, in terms of getting those early adopters that can help you um, validate your proposition, but also establish that evidence base that shows the impacts that you can make. And I think that that's an ongoing process. I don't think you've ever cracked it.
Mm.
Um, but I think at the very beginning, it's how do you land those first few implementations that you learn a huge amount from, but start to get those nuggets of data that can really start to show the impacts that you can make. And once you can do that, I think you can, the later deployments hopefully become easier because you've got that evidence. You can show that this isn't just a nice to have. You're actually making a real difference to outcomes, productivity enhancements, etc., etc. And that for me is really key.
So it's really about going in with that track record rather than a prototype or an idea at that point.
Yes, I think you will. I think in any industry you have potential partners or clients early who are willing to almost be your design partners, and can help you finesse,
Mm.
that MVP, if you like. But then the next stage is then to get that validation and that evidence base that really shows the impacts that you can make. And once you've got that, I think it's then much easier to deploy at scale and get more traction.
Yeah, this is clearly an impactful product. And then with your background of both having the sort of med tech background, but also personal experiences to have the realization for the need, it sounds like an easier approach to investors. So what was your experience of the pitch process and investment generally?
Yeah. So we are currently angel invested. Um, and I think you're right. This is a very emotive space. Unfortunately, most people out there have some understanding of cancer. I think it's rare to find someone who hasn't been touched by cancer in some way. We all know of someone or have a loved one who has gone through a cancer diagnosis. So I think certainly from an early stage investment perspective, um, my background and that personal experience comes across, and that understanding of the problem that we're trying to solve. But I think a lot of the investors that we've raised funds through have had that personal experience and get it. It's something that people can relate to, and understand the problem that we're trying to solve. Yes, that's definitely helped.
And what's been made possible through investment? What does the company look like today compared to pre-investment, if you like?
Yeah, so pre-investment, I was able to get the concept designed, bring it to life, to a point where we had a good prototype that we could put in front of people and start to add color to what it is that we wanted to do. But as we started to raise some external money, it's clearly allowed us to build out our team, which is still a small team, um, but get those first deployments and be able to support those deployments fully. So we've gone from being able to build a concept that people could just understand what it was we wanted to do, to now have something which is a fully fledged solution that we're able to deploy. So in terms of being able to build the product, establish a brand, and put in place a small core team with the expertise, um, to allow us to really hit the ground running and be prepared to deploy and execute well. That's really where it's made all the difference.
Yeah, and give us an idea of what that's meant for you as the founder. How's your role evolved from, I suppose, the very early days to today?
Yeah, well, I think founders inevitably have to be, I guess, a bit of a jack of all trades. You know, at the beginning, you have to be able to do everything from trying to raise the investment to getting the product built to doing the sales. You know, your chief bottle washer and CEO all at the same time. You know, one of the things that I learned through my previous experience actually is as I've built out the team was, I guess, the level of experience that people you bring on at different stages. Like, do you start with a small team of more senior people or a larger team of more junior people just to allocate the same budget, for example? One of the things that we've done at Careology is start with a small team, but of people who have all kind of been there and done it before, and have really helped me and the business hit the ground running and could just get on with the job in hand. But I think for me as a founder, yes, moving from that when it was kind of me, myself, and I, to then starting to work with, say, design and R&D to start building that prototype and bringing it to life, to now deploying the proposition. Yes, I've now got a great team of people around me who are helping me deploy. But I think one of the challenges that I guess I have, and I think is quite typical of founders, is also starting to delegate more and being willing to let go. When it's been your baby and you've had to do everything, even though when you bring people on, it's being able and willing to be able to say, no, I trust you. I'm handing this over to you now.
And have you got any advice for people in doing that? I know that's such a struggle for most founders.
Well, I think it comes back to this point I'm making about making sure the team that you bring on board, you've got real trust and faith in, because I think if you've got that trust and faith, it's much easier that you know you're handing stuff over to people that can deliver and do what you want them to. And we've definitely done that at Careology this time around. We've got a great little team. And I think also part of the narrative with that first team is, for me personally, I will say to people, if I'm trying to hang on to stuff that I shouldn't be, please tell me. Just tell me to let go if I'm being too keep my arms around things. So I think that's very much around the culture though, and how you start to build out that team, being quite disciplined with yourself to keep reminding yourself you've now got other people there that are probably better placed to run with stuff, but also letting them know that you won't be offended if they give you a bit of a tap on the back and say, you're doing something here that you shouldn't be, let go of it.
Yeah, absolutely. And what's next for Careology? What are the big goals over the next year or two?
Yeah, so I've alluded to some of those already, I guess. You know, we are making really good headway. We're at a really exciting time. I think we've reached a real inflection point now of deploying the platform. But I think we're now very focused on making sure the partnerships and the deployments that are now live and out there, we're working really hard to learn from, iterate from, understand what bits of the platform people are really engaging with and which bits people aren't or need enhancing. So that's very much front of mind. Certainly then growing from there, getting that evidence base that we've talked about so we can start to deploy more broadly and at scale. Yeah, I think for the next 12 months, that's very much key. Capitalizing on the deals that we've secured.
Certainly sounds like an exciting time. So for those listening, where can they find out more about Careology?
Yep, so the best place is to visit the website, which is careology.health. And also the app is available on the App Store, Google and iOS. So if you want to have a play, please do so. And if you're sitting there knowing anybody is currently going through treatment, please encourage them to download and really use the tools that we've created.